Okay. I hope it's okay that I'm recording this. If you do not want to have your face on the recording, feel free to turn off your camera, change your name as you're comfortable. We would like to keep this so that we will have it to share with some of the folks who aren't able to join us today. So this is going to be a general kind of welcome to Upglow, welcome to our work within healthcare. I want to introduce myself. For those of you who don't know, I'm Tamara Frolic-Steen-Appel. I am a job coach sitting in Upglow Chicago office, and I'm also the head of the National Healthcare team. I've been working in this field at Upglow for almost 9 years now, and I love working in healthcare, although I know it can be a complicated field, and I'm excited to be here. I would like to introduce or let my colleagues introduce themselves. Christy, you want to say hello?
Sure. Hello, everyone. I'm Christy Walsh, and I'm a job coach here, handling healthcare as well, and I'm in San Diego. Nice to meet all of you.
Kiri?
Hi, everyone. Thanks so much for joining us today. My name's Kiri, and I also work in the healthcare industry with Upglow. I've been with Upglow for a little over a year, and I sit in the Eastern region in New York.
So we're so happy to see so many of you here. You can continue if you want to introduce yourselves in the chat. Also, we're going to ask that you keep yourself in mute for now. I think that this is going to be not a very, very long webinar, and our hope is to have time at the end for questions and comments. So that's kind of where we're at. But as we go along, if you do have questions, feel free to put them in the chat box, and Kiri and Christy will keep their eyes on that, and we'll go from there. As I said, we're recording this. We'd like to have these. We have actually a YouTube space channel with other trainings that we've done in the past year or two. So if you are interested in seeing those, maybe at the end I will share that link, or you can ask your coach and we can get it to you as well. So as we're not quite at the beginning of 2022, but pretty close, we thought this would be a good time to do just kind of an intro conversation. I know lots of you are new job seekers, are new to Upglow. Many of you are new in the US. And so we thought this would be a good chance to just sort of share some ideas, some tips, some of the ways that we work, and have a chance to get to know each other a little more. So thanks once again for being part of it. Okay. So today we're going to talk a little bit. So one of the things we started about 2 years ago at Upglow is a career community, which means we are working together as coaches, and we're supporting you as a team, and then we want to help build community across Upglow, between job seekers in different places. So this is our career community. Those of us who are on the team, Christy, Kiri, and I, we meet pretty regularly, once a week or every week or two, to talk about resources, how to help job seekers, different career pathways. We'll talk a little bit more about what the career community is and what it means to you. We're going to just talk about some general career pathways in healthcare and share some resources with you. And then, as I said, we'd like to have a lot of time for question and answer. I tried to design the presentation to reflect some of the questions that you shared when you registered. But if there are more questions, we will be happy to dive in at the end. So as I said, we started these career communities at Upglow a couple of years ago with the idea that really we could help job seekers better if we thought specifically about different fields. As you probably all know, as you are joining the US healthcare industry, it's a very highly regulated world. There are lots of rules and licenses and processes, and even often to do the most entry-level job, like a medical assistant, you need to have a certification or a license. So we've really developed expertise working in this space. We've watched people have all sorts of different pathways to success. And we're here to support you on your process, in your career pathway. So we've really developed some good understanding. I would say Kiri's been with us for about a year and Christy's pretty brand new. I will say for someone who's been here a while that I learn the most from you all, from my job seekers and alumni. So, we don't know all the answers, but we will work with you to find answers. And as I said, we work really hard to understand career pathways and opportunities for you, given the highly regulated landscape in healthcare. We help you build connections with volunteers, with alumni, with employers, always trying to refine those conversations to figure out how to open doors and help you advance. And then the third piece of that is the real support for skilling, for figuring out if and when there are opportunities to help you learn new things or perhaps get certified in things that you've already done in order to access jobs in healthcare. So for everyone that looks different. We'll talk a little bit later. We've put a lot of effort over the past year into careers in clinical research. And we'll talk more about that, but we have some skilling resources for that. Everyone who joins Upglow has access to Coursera. There are courses on healthcare there. There are other courses. So we want you to constantly be getting new skills, improving, understanding the job market and how you're going to be effective in it. So today, the career pathways we're going to talk about include relicensing. We're going to talk about doctors, dentists, pharmacists, and nurses. We're not going to do a deep dive into this today, but we'll share some resources and we will just give some overviews and hopefully open up the floor for more conversation. One of the great things is not only is healthcare highly regulated, but each pathway is regulated very differently. Licensure in the US sits at the state level. So each state has a pathway. And then for each field, for whatever reason, they've created different steps. So we can talk about them and give you some more information. And then we will also talk about global and public health and work in nonprofits. We know, oh, wait. Oh, pish. Why did this go forward? All right. Oh, now I just keep going forward. That is not what I want. Okay, so we're going to talk about global and public health and work in nonprofits. As I said, we know that many of our healthcare job seekers have had opportunities to work in public health roles, working in community clinics, working around pandemics like COVID and other things, natural disasters. You have a lot of global and public health knowledge that we can help you to move into roles in nonprofits, in international development organizations, also in universities. So we've got our eyes on that. We know that there are great opportunities in clinical research. I think I mentioned a little bit about that earlier. We'll go into a little bit more info. And then many doctors are looking to work in hospitals and clinics, in pharmaceutical and medical device companies, and we can talk a little bit about some of those roles and just give you an overview. So Upwardly Global, as I said, has resources for you. On our website, we have some licensing guides. So if you go to the website and look under job seeker resources, there's a link. Also, you can copy down this. We're going to share this presentation and the slides with you, so you can use this, or you can ask a coach for help to find these, but they are on the website. I couldn't find a screenshot that would make it helpful to see, but we've created them for a number of different states. So we have licensing guides for California, Illinois, Michigan, New Hampshire, New York, Texas, and DC. We have a pro bono relationship with a national law firm that's helping us to update these. And if you're not located in one of these states, but you have questions about relicensing, feel free to look at one of the states, and there are links within the document to some of the national organizations that oversee the licensing process in the various fields. Also, this is something, if you're pursuing licensure, you should be talking to your job coach, getting advice, getting tips from us, because we can help you figure out what the different pathways are, what the requirements are. We know, like I said, each one is a somewhat different process. If you're relicensing as a doctor, you have to have your degree evaluated through the ECFMG, and that's different for pharmacists and nurses and dentists. So know that we have resources, that we understand the process, and we're here to support you as you move through it. Kiri, you want to take it?
Yes, thank you, Tamar. So as Tamar mentioned, if you are a doctor, if you're an international medical graduate, and you're looking to relicense as a doctor in the US, we can help with this process. And it involves passing a few different steps. First step is the USMLE step exams, which we have information about. And then eventually, after passing the exams, you would apply for medical residency program. And this is a long-term goal that does take time, and we have information about how to increase your chances in being able to match for a residency program, tips for being able to fill out the application. And then if you receive interviews for programs that you applied to, we can help you with interviewing and preparing for the interviews that you would hold. So we do work a lot with people who are going through this process, and we're always here to answer questions about it. And we also do try and foster community with our job seekers who are going through this process, and with our alumni who we're able to match for residency programs, so that we can have a community of job seekers who work together to prepare for the interviews, and who can get tips from people who did match on what to expect in those interviews and in the application process. Can go to the next slide. So for dentists, this is a completely different process and pathway. We do recommend looking into jobs, that are more entry level in the field first, such as dental assistant jobs that can take 1 to 2 years to get certified in, depending on the state requirements and which program you decide to pursue in order to do that. But it can be a great foot in the door in order to start networking with dentists in your area. And you'll often find that positions are in small practices, and it can be a great start to getting back into the industry. There's also the option to license as a dental hygienist, and this would require having your credentials evaluated and taking an exam, or going back to school and doing a 3-year associate's program. And in order to relicense as a dentist, there is a requirement to do a 2 to 3 year advanced standing program. And there's information about all of this in those licensing guides that we mentioned. And since it does vary by state, which pathway you decide to take, whether it's dental hygienist or just going straight into the relicensing process as a dentist, we recommend talking to your job coach first to get a good idea of what the different pathways could look like and what would make most sense for you. And there are other job opportunities available in the field that wouldn't be necessarily in a dental practice, such as being a dental product sales representative, pharmaceutical sales representative. And these are all also pathways that we can help discuss with you. So for pharmacists, there's the option to start your career re-entry into this field as a pharmacy technician. This role doesn't require that you get a certification. However, it is possible to get certified as a pharmacy technician, and it can give you an edge in the job search process if you are certified. These jobs tend to be lower paying, but if you plan to relicense as a pharmacist, there's a requirement to complete 1,500 hours, and this type of role can help you towards meeting the 1,500 hour requirement process. And similarly to dentistry, the relicensing process for pharmacists does require that you have your previous education evaluated to make sure that it meets the requirements to be able to apply for licensure. And it has the 1,500 hour requirement as well as passing an exam. And these requirements do vary by state. So in the resources that we send out afterwards and in those licensing guides, there you are able to click links and go to different national websites that show all the different requirements for each state. And there's also other job opportunities available in the pharmaceutical industry that wouldn't necessarily require this licensing or certification, such as in pharmaceutical research or in biopharmaceutical manufacturing. So in the nursing profession, there are entry-level jobs available, such as certified nursing assistant, home health aide. Depending on your state or depending on where you're applying to, these jobs might not require certification. However, a lot of companies and states do require that you do get certification in either of these areas, but they tend to be quicker certification programs, and we can help you identify which programs might be best. And it can be a good way to start to get experience in medical practices here. And if you are not familiar with electronic medical records, doing a CNA or other entry-level healthcare profession can give you that experience in electronic medical records so that you are able to add that to your resume. And for the relicensing process as a nurse, this also requires you to have your previous credentials evaluated and that you pass an exam called the NCLEX. And upon passing that exam, you're able to register as a nurse. And a lot of people in other areas of healthcare may decide to pursue getting licensed as a nurse rather than maybe relicensing as a doctor or another area, because this process can be quicker than those processes due to the fact that it's typically just having your credentials evaluated and then passing the exam. And the nursing profession in the US can be really lucrative and have a lot of opportunities for growth. And there's often a high demand for nurses, especially at this current point with things going on in the pandemic. So if you decide that you want to move over to nursing, that's something that you could discuss with us as a potential alternative pathway to your previous medical experience. And now I will pass it back to Tamar.
Thanks, Carrie. Yeah, so those are some of the more specific clinical roles that we work with. You know, we're happy to support you as you move around. If you want to make a change, to become a nurse, you will have to have passed a nursing program, but that can often be a more certain outcome than relicensing as a doctor, which takes a lot of time and a lot of money and is not guaranteed. But we would certainly, your coaches would be very happy to talk to you about that. So we see a lot of our job seekers have interest in global and public health and nonprofit. As I said at the beginning, there's a lot of interest in these fields. There's a lot of demand. We have folks now working in public health as contact tracers, as epidemiologists, you know, bringing your skills into a public health setting. Many of you have, even who didn't study public health, have done research or gotten some familiarity with the field. So it can be a really excellent pathway. There's a huge amount of demand. For example, I worked with a woman who's now the head of contact tracing for the state of Illinois. She is an immigrant from Nigeria, and she came and she had already worked in public health and was able to move up fairly quickly in the state, bringing her international expertise. You know, so people who have program and project management experience are very high in demand. People who've worked in monitoring and evaluation, people who have understanding of malaria, HIV, epidemiology, infectious diseases. As I said, you know, I've worked with folks who, you know, experienced the earthquake in Nepal or have worked in HIV clinics around the world. That experience is so incredibly valuable. And we want to help you, if that's the pathway you choose, to find opportunities to grow in that way. We know folks have gone in as program coordinators, program associates, program managers, officers, technical advisors. Sometimes our folks start out with working with refugee resettlement agencies or other community organizations as medical case managers or community health workers. There are many, many ways to access the US health system and contribute. These fields here are typically less highly regulated and more open. And you can work to create a resume that really highlights your relevant skills. We can help you with training on Coursera for sure. There's training on contact tracing for COVID-19. There's data analysis and things like that could help. There are some courses on public health and epidemiology. So really can be a good pathway for folks, and we always want you to consider all the options that are available, because as we've mentioned, relicensing can be very time-consuming, expensive, and not a sure thing. And we know there are other opportunities to use your skills and expertise. So as we've alluded to, we've put a lot of energy over the past year or so into clinical research. We know this is an area of huge demand. There are thousands of clinical trials going on in the US. They're going on in hospitals and universities and pharmaceutical companies and standalone research institutes, and they need staff, and it's often less regulated than going into clinical care roles. So we think this is a great opportunity. We have had for the past year a subscription to City Training, which I'll talk a little bit about in a moment. And we think we see people getting good starts. There are huge growth opportunities in clinical research. You know, you can start as a research assistant, you can move up to be a research coordinator, you can get more education. There's a lot of interplay between clinical research and the academic world, or as I said, working in pharmaceutical or medical device companies. So there's great opportunities in this field. So that's one of the reasons we're really excited about it. We also have some amazing volunteers who have offered to share information. So if that's something of interest, definitely mention it to your coach and we can help you move forward with some informational interviews, with accessing city training, and exploring opportunities to volunteer. So this is City. It's a national program. It's the Collaborative Institutional Training Initiative, and it is something that many organizations are using. We, as I said, have a subscription. It's being used by universities and hospitals and companies. You will often see on job postings that they will offer you the City training as part of your onboarding process. But we know that it makes sense to get some of this background training to help you, especially if you don't have a lot of experience, to understand the clinical research process in the US, to be comfortable with some of the language of clinical research, and to be able to really express your interest and your knowledge. So some of the courses that we know our job seekers are taking, there's a course on good clinical practice for clinical trials with investigational drug biologics. There's HIPAA, health privacy. Now, this is something that is very important in the US health system across the board. So doing HIPAA training can be good for anyone who's interested in working in healthcare. It's the Health Information and Privacy Act, and it's really helps professionals know how information for patients and folks who are participating in trials can be shared or not shared. You know, so very important in the US. Related to that is a course on information privacy and security that goes even deeper into that topic. Biomedical research training, and then we have access through our City subscription to a course in the foundations of clinical research coordinator roles, and then an advanced training. And those are really great if that's the pathway you want to explore, to be able to talk about the role, understand the pieces. You know, to work in clinical research in the US, you have to know about good clinical practice and HIPAA, but you also have to know about budgeting and project management and all the clinical skills that you bring. So you doing these courses on City can be really valuable. And so we really encourage you, if this is an area of interest, to move forward with it. Like I mentioned, everyone in our program has access to Coursera. Here are some of the Coursera courses that touch on clinical research. So we want to encourage you to look at those. They could be a little more at the beginner level, thinking about data. We know that that's an incredible area of growth in healthcare, around data analytics, around understanding how to use data, both in clinical research, but also broadly in healthcare provision. So encourage you to look at some of these trainings, to dig in, to see what catches your interest. You know, we know that to work in one of these professional fields, you really need to be able in an interview to convey a knowledge of the field and a real interest. So if you have that kind of passion and some background knowledge, you can often get a job based on your healthcare knowledge from your country of origin, and then really have an opportunity to grow professionally. But you've got to be able to talk like a professional. So doing these trainings can be incredibly helpful on that, in that pathway. So we also have job seekers, some who come with background in other health roles. We work with medical technologists and physical therapists and dietitians, and we know there are all sorts of roles in hospitals and clinics. So we want to work with you and help you identify what makes sense as your pathway. You know, sometimes our doctors who have extensive surgical experience can relicense as surgical assistants or technologists. Some folks want to work in radiology and EKG monitoring. There are so many opportunities. And we are working at the same time as we're working to understand these opportunities, we're also working across the country to build relationships with hospitals and clinics so that we can help our employer partners understand the value that you all bring as professionals, and that even though your pathway may be somewhat less traditional than someone who grew up in the US and just decided to be a surgical assistant, that it's to their advantage in their institution to bring on an internationally trained surgeon as a surgical assistant, or in some other role, that you can bring communication advantages, that you've oftentimes started programs and led programs in community health and have administrative skills, have backgrounds in medical billing, coding, file review. That's another pathway that can be really satisfying to bring your clinical knowledge into a hospital or insurance setting. So we really want to work with you to explore the full range of options to help you move forward. And we know that it can be, you know, the pathway can be sometimes not so straight, but that doesn't mean you can't have a really successful, satisfying career. And we're here to support you and work with you through that process. Whew. So I've shared a lot with Kiri, and would love to hear from you if you have comments, questions. I think I will stop screen sharing and we can talk. So you can either put a question or a comment in the chat or come off mute and ask your question. Or maybe we answered all the questions you all have.
I had a question, Tamar. Can I ask you?
Of course.
Yeah, I had a question about the process of medical certification. In that process, first of all, is there a fee to do that? And second, if we choose the path to do USMLE, how can we get the materials and how can we study those materials? Are there any courses to follow? And how much would it, if you know, how much would it cost? And after we get our documents certified, we just go and take the exam, or we need to go back to school and study and then take the exam?
Great questions. Yeah. So I'm gonna take a quickish stab, and then we can talk about it more. So there are definitely costs associated. So there are 3-step exams that you need to take that each cost about $1,000, and it is very highly advised to do some training. We know of some training prep modules that you can do. It can be, so depending on what resources you use, it varies a lot, the cost. You know, I have folks who share books with each other. Other folks I've worked with go to fairly expensive training through like Kaplan University. So there's a big range. We can talk about that. Frequently, people do work while they're relicensing. Somebody asked a question about clinical research. It can be a great pathway. It can also help you build connections, because one of the things, so in order to apply for residency, which is the gateway to becoming relicensed after passing USMLEs, or in addition, you also need to get some US clinical experience. So having research experience strengthens your application, but also might put you in connection with doctors who would let you do shadowing, do externships. So it's putting all the pieces together, and it can be a very long and complicated process. There is also there used to be 2 parts of the step 2 test of the USMLE, and now instead of one piece, they do a language evaluation. So it's a pretty involved process. And so we want to help you with the whole thing, but also we want to help you in the meantime work in your field.
Thank you very much. Thank you.
So I see there were some other questions. It looks like, Kiri, you've taken a stab at them.
Yeah, if you wanted to add anything, there was a question of if it makes sense for an IMG to go into clinical research while preparing for relicensing. And I had said absolutely, because it can help your residency application process, residency application, to have that US experience in clinical research on your resume. Sorry. And then there was also a question for Mary on whether someone with an MD degree can work as a pharmacy tech. And I answered that you can, and it can help to get certification as well as a pharmacy tech.
Great. Those are great answers. Pharmacy tech is one of those areas I think we haven't, it varies a lot by state. So it's important to work with your coach to do some research in whatever state you're in, but it can be a good pathway into healthcare. It can also, frankly, be frustrating. It's pretty entry level and not hugely well paid. It's not that well paid, you know, but it can certainly be a stepping stone to other opportunities. I've also seen people who typically are pharmacists, but not always starting as pharmacists, who train as pharmacy techs and then get additional training for compounding, who find opportunities in hospital or industry, which can be a little more satisfying than the retail pharm tech, which is pretty straightforward. Yeah, and clinical research is a great, as I mentioned to Zia, Fatih, I think you asked, clinical research is also a great pathway for IMGs that want to relicense. It really strengthens your application. It builds your network. It gives you opportunities, hopefully, to publish. So it's a great option. And Zohalia, it looks like you're asking about credential evaluation and how much it costs. It varies, once again, like everything. If you want to relicense as a doctor, the credential evaluation goes through the ECFMG and is part of the funding you pay to register there. I should know, but I don't remember specifically how much it costs for that first step with the ECFMG, but we can look into it. If you're looking at different pathways, there are different organizations you have to go to. I believe for pharmacists, they have to have their degrees evaluated by ECE. Nurses, it's a whole different pathway. So I think the best answer is that we would do research depending on who you are and what your long-term goal is. But I often tell job seekers that it's not the place you want to start. It's not always necessary in the US to get your degree evaluated to get a job. So, you know, that's a great thing to talk to your coach and explore together, depending on your goals and the time.
Okay. Yeah. Hi, Tamara. Hi,
Hi.
everybody. Hi. I'm a medical lecturer. I graduated from outside of United States. I do my step 1 and step 2, and I'm going to apply the U.S. residence now. Tamara is my job coach. Thank you for that. I'm interested for a clinical research, because clinical research is very important for applying U.S. residence. So how can you help me to get some sort of clinical research experience? I live in Columbus, Ohio. Is there any opportunities here? Yeah, that's my question. Thank you so much.
Okay, thanks, Abdikani. It's good to see you. Well, so the first thing is we have the training. The city training can be really, really helpful to learn about clinical research. And then we, you know, can start applying for programs and opportunities. I actually have an alum who's working in clinical research in Columbus, so could reach out to him and see if he'll do an informational interview with you. Columbus is home of, you know, one of the biggest universities in the US. And so there's tons of research happening at the Ohio State University. So we'll work together to help you connect and get opportunities.
Thank you.
Okay, so Kiri answered Fatih's question about resources, about funds for preparing. We have some limited scholarship money. You need to work through with your coach to access that. It depends. It's a competitive process. We have applications. So we can talk one-on-one, and if we have funding and you qualify, we're happy to share it. But it is quite limited, so just not to over expect, but we're happy to support you in that. Interesting, Mary. So you've sent resumes for research assistant or clinical research jobs. It doesn't work. Although I have a wealth of experience in the field, I cannot get any positions. Well, you know, it can be sometimes a function of not having your resume tailored specifically to the research positions. So you should be able to work with your coach to figure out, you know, how to customize a resume. That's really important. You know, for many of the doctors and pharmacists in the program specifically, if an employer looks at the resume and doesn't understand why you're applying for the job, you can not get attention and not get picked for an interview. So so the first thing is customizing and really working with your coach to create a resume that really highlights your research knowledge and experience. And doesn't look too overqualified. We also have some resume trainings on our YouTube page. Maybe I'll show that in a moment. So it's working with your coach, and it's continuing to apply, and it's working on building a professional network. If you're interested in research, we're very lucky. We have a good number of alumni who are available to do informational interviews. So ask your job coach about that. It takes a long time. So not in healthcare, not being an immigrant. I have in my life gone through job searches that have taken over a year. Job search in the US is hard. I want you all to be able to hear that and know that, and that's why we're here to support you. We don't have any easy answers. We wish we did. We know that, you know, you hear you're overqualified, and then out of the same mouth, you hear that you don't have US experience. So one of the things that Upwardly Global is really working to do is to build relationship with healthcare employers to help them understand who you guys are, why you come with, you know, the extensive experience. Many of you weren't ever planning to leave your home countries. And so your resumes don't look like someone who grew up in the US and just has moved up in their career. So we work on that. We want to help you. We want to support you. As Kiri has said in the chat, you know, interviewing in the US is a whole different thing. So you've got resumes, you've got the interviewing process, and you've really got the goal of helping the employers to understand why you're a good fit for the job. And that's why we're here to help you. So talk to your coach about getting signed up for some mock interviews. We as coaches can help you with mock interviews. We can connect you with volunteers. We will have in the future, maybe we'll just do a whole webinar just on interviewing in healthcare and ask some of you to do some practice, because that's what it takes to get better at it. And, you know, you can't give up hope. We do know that in the US in general, but certainly in the healthcare industry, there's a huge amount of demand. So we just have to keep working together to help you all put forward strong applications and help the employers understand how valuable you are as trained professionals who come with experience, who have multicultural, multilingual knowledge that is we are desperate to have in our field. So it's a collaboration. There aren't easy answers. I know it can be really, really frustrating, but we're going to work through it together. We're going to do what we can. We want you all to be successful. We know you can be successful. And so we just keep working and refining the process. Oh, I talked so much, I made you all exhausted. All right, I'm going to quickly see if I can show you our YouTube page. And we'll put so that's a link to it, and I am going to share. So I hope you can see over the past years, we've done a number of trainings on entering the field of clinical research, on global and public health, on career pathways, on resumes. So I hope that you can all take some time to explore some of these other trainings. Keep talking with your coaches. Do not give up hope. We are here all about the hope. We know that you can be successful, and we are glad to be part of your journey. And reach out with questions. We will send a copy of this webinar and some links to everyone who has been here today. Does anyone else have any questions before we say goodbye? All right, well, thank you all for being part of this today. Kiri, Christy, thanks for being part. And we will all keep moving forward. And I love to be a source of positive vibes. It's because I know that you all can do it, and you will do it, and we will do it together. So
Thank you
take
so
care.
much. Thank you so much.
You're so welcome. Bye, everyone.
Bye.
Thank you. Thank you
You're
so much.
welcome.
Thank you so much. It was very helpful.
Bye-bye.